Good evening. I'm Dr. Paul MacPherson, and I'm a specialist in infectious diseases at the Ottawa Hospital. My practice focuses primarily on the health care for gay men, including treating HIV and preventing new HIV infections. As a gay man, I have faced stigma and false stereotypes. And as a doctor, I've seen how stigma and stereotypes impact the health of my patients, including both men's mental and physical health. Too often, the relationship between gay men and the healthcare system is a challenge and one that many men would prefer to avoid. As an example, I'd like to tell you about a new HIV prevention strategy known as pre-exposure prophylaxis, or PrEP. PrEP has been proven in clinical trials to significantly reduce transmission of HIV. And dedicated clinics in London and San Francisco are now showing a 40% reduction in new HIV infections among gay men. In Ontario, it is sadly a different story. From 2013 to 2016, there was in fact a 10% increase in new HIV diagnoses. And while HIV infections dropped by 6% in Toronto over this time period, new diagnoses in Ottawa increased by 44%. So far in 2017, there have been more HIV infections in Ontario than there were to this time 1 year ago. This is a clear call to action. Why is this happening? There are a number of potential reasons. One reason is HIV prevention efforts in Ontario have focused on men living in Toronto. It's time for local solutions. We know from our own work that 25% of gay men living in Ottawa are uncomfortable disclosing their sexual orientation to their doctor. Another reason is gay men experience significant barriers to accessing informed health care for gay men, including access to PrEP. I am proud to say the Ottawa Hospital now has a dedicated and growing HIV prevention clinic. We believe in patient-centered care, in supporting people in setting their own health goals and helping them achieve those goals. That's what we believe in at the Ottawa Hospital. A key milestone in our work came with the Ottawa Hospital's commitment to gay men's health. This is unprecedented in Canada. I don't know of any other hospital in Canada that has openly and publicly committed itself to improving the lives of gay men. This is a monumental step in breaking down those barriers. And I couldn't be more proud that it's happening here in our community at our hospital. The Ottawa Hospital is now poised to be a leader in this field and a proud example in the delivery of minority health care. We not only want our hospital to be recognized as a welcoming, an accepting, and an informed healthcare facility for gay men, but we also want it to be a resource for healthcare providers across Canada and beyond. With that goal in mind, and along with some very talented and dedicated people who are here with me tonight, we have set out to better understand the healthcare needs of gay men as defined by gay men, how they experience the healthcare system, and what they need from their healthcare providers. We are creating magic in Ontario. Magic is men's access to gay-informed care. We will develop, implement, and evaluate a multimodality healthcare system that will provide gay-informed, gay-relevant, evidence-based healthcare for gay and bisexual men anywhere in Ontario. This is our commitment to making sure we get the right care to the right people in the right way. Through this, we at the Ottawa Hospital are opening doors to the future. Thank you.